I believe that there has been an intersection, as mentioned, concerning the social justice movement, the roots of structural racism, where social and economic inequalities disproportionately are impacting minority communities, have surfaced following the tragic death of the gentleman in America, George Floyd. Mohamed, you yourself were raised in South Africa during apartheid. You've worked in Kenya. I want to ask you about how policymakers can reconcile the public health concerns alongside peaceful movements to unroot racism during this ongoing pandemic. Drawing on your experience, what lessons can we learn, Mohamed?
You know, Theo, I think we are seeing the convergence of three main sources today, lying in uneasy juxtaposition at a very critical time in human history. I think firstly, we're seeing a combination of infotech and biotech, which is giving high-tech companies, the corporate sector, if you may, and various governments totalitarianizing surveillance capabilities. I'm not using the word totalitarian, but it's totalitarianizing type of capabilities. So on the one hand, there is a public interest to protect. On the other hand, there's a question of individual liberties and autonomy. And the question is that how much do you give away in terms of your privacy? At the same time, you've got a pandemic, which is global. Perhaps it's the only entity that's working the way the entire human race should be working, is the pandemic itself, ironically. And thirdly, we've got a list of inequities that have been structurally embedded in society. And today, all these things are coming forward. Now, interestingly enough, what we're seeing are symptoms of this very deep tensile stresses that societies have to grapple with. And I think that there's a total breakdown of trust. We need new fidelity bonds in any relationship when things go wrong. You'll find unwritten bonds of fidelity having broken down. We got to mend those fidelity bonds, the bond of trust. I think we need a new compact of agreement that will bring about a greater understanding of how all parties can be working together.
Drawing on that social compact, Mohamed, I don't know if you can elaborate what you're saying here, because we are faced by huge upheaval, as you have described, and we live in a much more interconnected world now, where maybe even one could say that we've moved towards networks of publics, as opposed to just simply localized communities. We're now globally connected. And how does such a compact of trust get built when we're disparately separated?
I think it can work quite well. I mean, the very fact that, you know, we are a globally connected community, whether we like it or not, globalization is here to stay. And I think that mediation is one way at a global level that a new compact can be arrived at. I don't think this compact can be arrived. I mean, what we're seeing are symptoms of it, which are articulating themselves in sort of protests, which are visceral, one can understand. I mean, I lived in South Africa. What we saw with George Floyd was something that happened every day, if not every hour of the day. I mean, I wrote a book on this, and 60 years ago, I saw this happening in Pretoria when I was a student at school. And talking about the inequities of society, I mean, what's new? 50, 60 years ago, we were talking about the rich North and poor South. We are talking about glaring inequities, and today they right at our doorstep.
But I guess in this healthcare crisis has brought to the surface social inequities as well, and maybe even disclosed to us how big the gaps are across the globe. And maybe it's entrenched them to some degree as well as bringing them to the surface. But where I want to draw on your expertise, Mohamed, is how does mediation function in these processes where we live in a globally interconnected world? We need to have a holistic approach to both embed the healthcare crisis, the environmental crisis, and also now the social unrest, which is without doubt connected to these areas.
You know, Theo, I think one of the basic and fundamental principles of mediation is listening. I think that we have lost the art of listening, and it starts right from the family, into the community, into the street, into the city, into the country, and at the international level. And I was just listening to a program this evening at Harvard by Dan Shapiro about the bottlenecks to making major changes. I think besides excavating the archaeology of conflict that we need to deal with, we need to be able to listen. And I think that the paradigm of Nelson Mandela is the one I tell to people. He had the ability to sit, I mean, he was capable of keeping himself, bracketing himself out of the whole issue and sitting on the opposite side and seeing himself from how the other person looked at him. So I think mediation has the capability of allowing it to be used at various levels. I mean, it's a process that is highly workable. It needs to be given an opportunity. And I'm very confident that negotiations can take place. It's the only thing we can do. I don't see it not happening, but we need stakeholders, we need people who will be able to make that happen outside the adversarial context.
And in terms of outside the adversarial context, I think that's quite crucial to a mediation process. As you've also mentioned, you picked up on how listening is so important. And I think that's also to allow ourselves to speak, to allow suffering to speak, to allow vulnerability to be exposed so that we can start to mend these cracks that have opened, these chasms within our system. And we are discovering how underprepared we are for a healthcare crisis. Now, Mohamed, you yourself are also a trained barrister. And I know you've mentioned before you have the training in mediation. I also understand you have training in conflict practices and conflict resolution. Now, bringing that in, as a pluralist thinker, and we've gone over this a little in terms of seeing how we're interconnected, how does the cosmopolitan ethic blend this enrichment and of offered by faith and culture, but also science now? Because I think this has become even more relevant to today, is science is becoming a guiding path to policymakers. And it's always been there, but possibly it's much more at the forefront than it had ever been. How do we develop our mediation mechanisms to incorporate public understanding and to broaden that understanding so that we can embrace these different sides of the dialogue?
You know, the whole notion of cosmopolitanism is something that has been written about by Kofi Anthony Appiah in his leading book. And obviously the main proponent of this principle today globally is the Aga Khan. I mean, the Aga Khan has lived this process, and not only today, but I mean, I was at a school that he set up in 1961. And I can recall the speech he gave there. He said, if Muhammad, he didn't mean me though, Muhammad and Jonathan and Jorage could work together, play football together, and school together, then they'll be able to live together.
Yeah.
So I think education is very much at the heart of the process. How do we educate people? How do we educate people to appreciate the other, not as a factor of tolerance, but to appreciate the other as the part of yourself, as the only way that you can fulfill yourself and your relationship to the cosmos is by accepting the other as part of you, as part of your common humanity. Often it's very challenging because people do not want to talk to people who may differ with them. But that may be very discomforting. Sometimes somebody may differ from you, but the whole purpose is that person has a right to be heard. You know, in the mediation program we did, we were very fortunate that we used paradigms of thinking that were based on these type of principles. Our main trainer was a chap called Tony Watling from Britain, who was an outstanding trainer, but he was also a learner. And Tony was able to teach mediation practices in Britain, but he was also able to do it in the north of Pakistan. He was able to do it in Afghanistan. He was able to teach in Syria. He was able to teach in Nairobi. He was able to teach in Lisbon, in Maputo. So this whole process of embracing the other as part of yourself in a larger understanding of what it means to be in a common humanity is at the heart of the cosmopolitan ethic.
Do you think we are only starting to learn this process, Mohamed, or do you feel, I mean, you come from a diverse background, you have family in Canada and in South Africa, in Kenya, and also in the UK. And I wonder from your perspective how you feel this has evolved and unraveled. We've seen globalization happen at a rapid rate. We've seen the pandemic bring interconnectivity to the forefront. We're here to connected via Zoom, and so many of us have joined us through digital connection. But is this a new tipping point? Is this a new change in globalization and cosmopolitanism?
I think it's been there. I mean, I come from a family that is, and when we had a reunion in Canada about 10 years ago, we had 450 people from 22 countries, mm-hmm. who were all related by blood. And I think this is not unusual. I think this is part of the whole scene today. We're all diasporic, we're all cosmopolitan, we've all got children living in different countries. Mm-hmm. We got families who are married across the religious divide, across the ethnic divide, across the social divide. I think that what this pandemic has made us realize that we can no longer live in silos. You know, everyone is our neighbor. Everybody is closely connected. And I think that how we put that into practice is the real issue. How do we make that work for us with mutual respect, with understanding, and with a social consciousness? We have to understand that all these things will be meaningless. They'll become slogans if we do not address the basic problems of social justice in society.
Well, that's a very
interesting. Can we still have racism after all these years? Can we still have phobias of a different nature based on what color of your skin, what ethnicity you come from, what religion you come from, what nation you come from? I think that the new generation is beginning to say, we don't want to be what Michael Bellin called parties to the collusions of anonymity. We want to see things happen. Not only do we want to be non-racist, we want to know what did we do to eradicate racism. And I think that cosmopolitan ethics, mediation, negotiation, education are all interconnected. And that's where your organization, I think, will have a big role to play. You know?
Well, I'd love it if Cov360 can have that role to play. So many fantastic volunteers, globally based, and certainly connected in creating a bridge between communities around the world through a network of the public. But can you elaborate a little bit on what you're saying there? You mentioned the collusion of anonymity. Can you disclose what you mean by that, Mohamed?
Yeah, it's a medical term that was used by Michael Bellin in 1960s. He was a Hungarian psychologist who was very influential in his work in Britain. Mm-hmm. And he spoke about the atomized notion of medical care. His book was called The Patient, I think it was called, I'll just cut it here somewhere. His book was called The Patient, His Doctor, and the Illness, where everybody looked at the patient, but nobody had the responsibility to tell the patient what he's suffering from. So specialists will be talking not talking to each other, but talking at each other. And the patient would be like an atomized object there. Like Michel Foucault speaks about, you look at the patient as something out there that needs to be pathologically addressed rather than holistically taken into consideration. I'm using that with Michael Bellin's apologies, that as a process where people are saying that nobody takes the responsibility for changing things in society. And people want to say, we're not complicit in it. We may be coming from a privileged background, we may not, but we're all part of an interconnected humanity. What are we doing to make sure that little child in the street does not go hungry? I mean, there is certain civic responsibility that we need to undertake, which if it's not being acquitted properly through civil society or governments or people, somebody's got to take the responsibility of making this happen if we want a harmonized humanity. Otherwise, what we're seeing now happening in the streets may even be worse. The pandemic is not going to go away,
Well, it's interesting. I think it's so challenging to make this present moment now, where there is a temporary disjuncture from normality, let's say, where we've gone through this dramatic upheaval, there's been disruption globally. And how can we make maybe some of these environmental factors, the social areas, but also so much connected public health in this area, how can we make that sustainable? I found it interesting you quoted from Foucault, or reference to Foucault, because so much of his work on the clinic, but also in terms of how power and structures work in an interconnected world, how we become governed by these structures, is a fascinating area to explore. I don't know if you can elaborate a little bit in terms of the transformative engagement and public value that can happen through this process. I mean, it's time possibly for communities to be more involved in that. Do you believe?
I think communities are playing a major role. I mean, I was amazed. I was amazed. It's incredible. You know, I just realized that I do belong to the Smiley community, and I saw community at various concentric circles. I began to realize that there were so many communities of which I was a party at this time. It's interesting that my own community, the Smiley community, members of the community were volunteers, would phone my wife and myself every other day. Are you okay? Did you receive your food? Did you receive your groceries? So there were volunteers that would pick up our groceries and bring them right to our doorstep. But on our road, people who didn't belong to our faith tradition left little flyers under the door. If you want your medicines picked up, please just phone us, we'll go and get it for you. So community operated at so many different levels. And I think that we need to reinvigorate that process, because I mean, a human being becomes a human being through the process of that interconnectivity, what Martin Luther King calls, we are all knit in the same garment of destiny, what Mandela called, or the African people call Ubuntu. I mean, this is at the heart of existence. We are not atoms, we're not robots. And I think this has come out in a very robust way. I mean, even in Britain, about 1 million people signed up within 48 hours to play a role as volunteers. I thought that was very, very positive.
Yes, the role of mutual aid. I think you also alluded there to Ubuntu, and I'd just like to tell our audience we have a very special guest I'd like to introduce in a few minutes, and he'll be joining us on the panel. So before I do make that introduction, the virus does push us to think about public value, and we're discussing here the role of the public. We've mentioned the mutual aid that's arisen in the UK, where people have come forward, but that's global. That's not restricted to the UK. We've seen fantastic innovation, and almost a different definition of innovation, where it happens through the community upwards. I mean, through the experience that you've received, both personally, Mohamed, but also more broadly and reflecting on your own experience, what lessons do you have that we've learned from this? What guidance can you offer us?
You know, I think that the coronavirus is one of the first issues to affect us, to make us realize our interconnectivity. We are lucky that it's not more ravaging or in different fields. I mean, it's bad as it is. But I think we've begun to realize how vulnerable the human society is. Yeah. Today, we're talking about a virus. I mean, imagine the type of wars that could take place. Systems of surveillance that can disable our entire water services, entire electrical services. Yeah. We've got that capacity. We've got the massive capacity to destroy ourselves. I think this is a wake-up call for us. I mean, Harari puts it beautifully when he says, history gives no discount. It's not going to wait for you. So he says, if the woman in Mumbai in the slum is too busy because she's looking after her 2 kids, and the person on the boat in the Mediterranean is looking for the horizon to be able to get off, and a person in a ventilator in Britain who has no time to discuss these issues, be it so. But tomorrow a pandemic or a climate change can change their lives. Every one of their times of living can be totally invalid. I mean, the whole medical care system can break down with one exigency. So this is a wake-up call for all of us to show the vulnerabilities that we are susceptible to. This is a pathogen that we're talking about. And yet at one level, we're available to go to Jupiter and fix up a problem millions of miles from the earth. And yet some of the basic things we are not able to be prepared for. So I think that one lesson is that how can we prepare ourselves for the new world we have entered into? And I think that this is a glaring example. It's right at our doorstep.
It brings the individual, the community, the state, the globe together. It really does, because this is a shared vulnerability. We are in quarantine together, or have been. Some of us are coming out of it now.
There is a principle in the African Bantu tradition that I am me because of you. If I dehumanize you, I am lessening myself. In my healing myself, I have to heal you. It's a very fundamental principle by which the African people have lived. And nowhere did this come out more clearly than at the time of the Truth and Reconciliation Commission, where forgiveness became such a powerful factor that it wasn't something imposed on the people of South Africa. I mean, if you read Desmond Tutu's book, No Future Without Forgiveness, it is unbelievable that how people could draw from their own cultural tradition to be able to forgive and to move on in life. And I think this is exemplified no better by anybody than Nelson Mandela himself. But Mandela was not the only person. I'm sure Albie will be able to tell you that that whole group of people, Dennis Goldberg, Amit Kathrada, Walter Sisulu, Governor Mbeki, they were a whole group of people who believed in the principle that you cannot requite bad with bad. Anything that's bad has got to be met with better. It's something good. So I can see Albie already has come on the scene, and I'll leave it to him to tell us about the wonderful work. Albie, hello, lovely to see you.
Yes, hello there. Who's my interrogator?
I'm here, Albie, just up here. So it's Theo. A real pleasure to meet you. It's a long time. Just to introduce, I saw Albie speak in Bristol over a decade ago, and it was an immense pleasure then. You've seen a huge amount of upheaval of your life, and you've been at the forefront of it, Albie. How do you feel what's happening now resonates, and what advice do you have for us as we're going through and living this situation?
I read somewhere, somebody said, the advantage of being pretty old is you can always remember times when things were worse. And in a sense, I grew up during World War II, which was just such a huge, terrible calamity with destruction. We got through it, and we came out in a sense stronger because we repudiated the racism, the Nazism, and so on. I've lived through the struggle against apartheid, which was a cruel form of oppression, institutionalized, backed up by powerful states throughout the world with racist, often theological kind of background. We got through that. And so from that point of view, we'll get through this calamity, and hopefully we will come out stronger for it. And one of the things that has come through to me has been the extraordinary sense of interdependence between human beings. Chatting to my son recently about something, I was speaking about dependence, where somebody dominates and somebody else is dependent. Mm-hmm. Independence, where you're separated, and it's a very important moment when you become independent from dependence. But there's interdependence, mm-hmm. which is the connecting up of the relationship between people, not hostile, not in that sense independence, meaning I'm separate from you, I want to get on with my life, don't get in my way. In South Africa we say, voetsak, get out of the way, becoming a principle of life. Instead of that being the connection, the relationship, we are human beings. We actually improve and enhance our autonomy through connecting up with other human beings, through nurturing, through culture, through association, through experience, through empathy. Empathy is not destructive. Empathy is not a surrender. empathy is a connection with other human beings that is very nourishing to our own souls, to our own beings. And it's actually interesting because it satisfies that element of curiosity. You place yourself into the lives of others and you're not frightened by it. You're not repelled by it. You don't feel keep away. Mm-hmm. How interesting, how astonishing, how marvelous human beings are in the interconnection. But one of the themes that I would like to see highlighted by people like yourselves is the question of the vaccine. Who will control the vaccine? Will the vaccine be an instrument of healing, of interconnection, of, if you like, love? Human beings expressing the interconnection with each other? Or will it be a weapon and instrument of accumulation, of national power, of aggrandizement, of domination? And it can so easily be either that. And I think it's important for the world to be prepared for the idea that the vaccine becomes the property of all humanity. We don't place water, or we don't place the rain, we don't place the air we breathe, we don't place oxygen in the marketplace. We're entitled to water, oxygen. We should be entitled to the vaccine. Yep. And humanity should feel obliged, not because somebody is going to lose an election or somebody's going to lose pride, should feel obliged that, okay, you can get certain bragging pride being the first, but you get the pride for being the first to help humanity, not the first to colonize an important element of health and healing so that you can become very rich very, very quickly, and you can call the shots and you can say, we are the greatest. We are the greatest scientists. We're more clever than anybody else. There's nothing clever about being clever. In fact, it can be very stupid to be clever in that sense when you're appropriating good knowledge and sharing out the good knowledge. And I believe in terms of the development of vaccines to the other coronaviruses, a big breakthrough was made in humanitarian terms, not allowing the farmers to colonize the vaccines and getting agreements between the health sectors in the different countries that whatever the intellectual property interest might be or could have been, in a case of a pandemic of this kind, there has to be a sharing out and a distribution of the vaccines to the countries and to the people who need it the most. Mm-hmm. And for me, that would be a very good way of reconciling inventiveness, energy, scientific knowledge, the pursuit of the good, which so many people want, with humanity and, if you like, a deep spiritual sense of human interconnection.
I love that you've mentioned the sense of the need for human interconnectivity, what's happened. I think love is such an important word that we need to use generously as well, so that we really embed it into how we think and act. But also it's interesting to reflect on these interconnections with the environment and using those principles, particularly water, which moves above and below ground, and it defies these natural borders. And this pandemic has really brought us together to defy some of those laws which we've imposed to a degree. In terms of...
I would support that completely. And I see a very strong analogy with climate change. It's all humanity. And if you allow some people, some nations, some owners of property, some inventors to just go ahead and say, well, they're not dropping bombs on anybody else. They're not physically assaulting anybody else. Where's the problem? In fact, that is the problem. They are depleting the atmosphere, and also they're creating that element of irresponsibility, of greed, of grasping, and disrespect for other human beings. So hopefully in this period in our world, in our lives, where on the one hand, people are coming together to repudiate the cruelty visited on black bodies, but in a massive way all over the world, people marching and speaking out there's clearly an ache for dignity and decency. And against that idea of misfortune somehow being an inevitable calamity, to convert misfortune into injustice, I think that's what's happening. And outer space, the sea, all these important areas, it's terrifying to think that they might be colonized, appropriated. The human gene should belong to all humanity, certain core features of existence, and that would include the environment, the atmosphere, the land. I see a strong interconnection, if you like, between the interdependence facing the virus and the interdependence facing climate change and the interdependence facing so many of the calamities that potentially face humanity.
And I think you've drawn on a few matters there, Albie. I was going to bring it over to Mohamed when he returns quickly, and we'll close off. We're a little over time, but it's wonderful to hear of that emphasis on both human rights, on environmental rights, on dignity, decency, and I think that emphasizing these areas is so important. And Mohamed, I will bring it to you for a final thought on the Darwin Trust and your work in compassion, because I think that resonates with what Albie said. But just before that, do you have any final words of advice for us, Albie, as a young generation coming forward? We're trying to bring connections and ensure that we build what Mohamed described as a new social compact of trust.
I've got a stock answer. When young people ask me for advice, I say the only advice I'll give you is don't listen to the advice from people like me. Be as cheeky, irreverent, in the case you from the Gool family. Fantastic, amazing family that's got such a strong part in South African history. I knew that your grandmother, Sissy, is that right?
Yes, that's great aunt.
Great aunt was very important in my life as it happens. She knew me as a little toddler, and she was feisty and independent and spirited. And I'd like to feel you like that. You don't look to us for advice. You listen to us. You see what we've done. You criticize our mistakes. You learn from the good things that we've done. You take heart from us, if you like. That's all I offer you. But you've got to find your own way, and you've got to be sharp, and you've got to be better than us. That's one thing one can expect of every generation. Be better than us. Take out the good. Here I'm offering you advice and telling you not to accept my advice, but take out the good that you can see in what we're doing and be better in terms of the bad things that we've done. Thank
you very much, Albie, and thank you for mentioning the great relationship you had with Sissy. I'd love to speak about that in over correspondence at some point. I think maybe I'm not so feisty in that I'm trying to tame that, but at the same time, there's a good time to be dynamic, and now is the time to bring people together. Mohamed, I'm not sure after what Albie said I should turn to you for advice, but I will turn to you to listen.
Well, I'd like to tell Albie, I'm a young man, so I'm one of the persons you're talking about.
Okay.
Yes, I think that basically we were involved in a group trying to uphold the memory of Charles Darwin, who is known for having said that it's survival of the fittest. I think he's misquoted. He said the survival for those who are most ready to adjust. And he said we need to be compassionate with those people. And so we were trying to work out a framework with a person called Patrick Pietroni, a very well-known medical man in Britain who had done a lot of work in different parts of the world, to see how we can bring compassion back on the table, to create the compassionate scholars of the future. So people going to different disciplines could go into that discipline consciously aware of how compassion can be part of their praxis, part of their training. I know doctors are compassionate, nurses are compassionate. We've seen how many people have given their lives at this time. But the question is, how can we bring compassion back in the practice of medicine, the practice of law, the practice of mediation, the practice of nursing, the practice of journalism? And I think it's all ethically bound with how do you look at the other, how do we look at, as Albie says, the environment, how do we look at social injustice, how do we look at the purpose of meaning? And I think that hopefully that this idea of the compassionate scholar, which has been so close to Professor Pietroni's heart and the group of people who worked with him for the last 10 years, may still find its place in human society. We haven't given up the vision, though it failed for other practical reasons.